Hey guys, Dr. Luke Stringer from Advanced Health Chiropractic, sitting here with Suzanne, our patient care coordinator. I want to take a little bit of time to discuss with you low back pain. So when you evaluate low back pain, or when we evaluate low back pain at Advanced Health, we address three main areas. First of all, the structure of your spine. Is it in alignment? Is it loading the joint with tissue effectively, correctly? Are the joints moving in their full range of motion, and the integrity of the tissue? Is it strong? Is it stable? Is it doing its job? So unfortunately, when we sit for a living, like many of our patients here, our spine can shift out of alignment. So when you evaluate healthy low back spine or healthy low back, we should see a nice even curve that measures around 40 degrees. So we discussed on previous videos, the essentially repetitive stress of sitting shifts our spine out of alignment. Well, all the tissue that anchors your lumbar spine into your pelvis just gets stretched, it's under stress, it's under strain, and over time it breaks down. How does it specifically break down? Well, when you evaluate healthy muscles, ligaments and tendons under a microscope, we'll call it soft tissue, should look really structured and uniform. However, there's repetitive stress, it just beat the tissue up and it starts to look like this. Well, fortunately, our bodies aren't going to allow us to walk around with tissue that's essentially all beaten up, right? So it just fills in the gaps. When it does so with something called adhesion. It's collagen, it's scar tissue. This then forms the foundation and the structures that stabilize and support your low back through movement. So when you go to move, simply sit, stand, go for a walk, go for a run, bend to pick something over. When this tissue is in the low back, it's weak, it's inflexible, it's going to break you down, it's going to cause low back pain. Unfortunately, this little stuff here is critical in essentially getting rid of your low back pain. Unfortunately, many providers don't know how to diagnose it and they don't know how to correct it. Well, luckily for you and our patients, we know exactly how to do that here in the office. And this is essentially how we do it. So the best way to evaluate adhesion within the spine is essentially how well this lumbar spine moves. Now, the primary function of the lumbar spine in terms of its range of motion is flexion. So your spine should be able to flex, and all these joints should be able to move essentially. They all should be able to flex and open up. However, through obviously some really specific examination, you can find the joints which aren't flexing. So drive through Suzanne, and then you can see Suzanne right at the bottom here, she's got some sorcery. And that sorcery indicates that that tissue isn't lengthening properly. That's adhesive. That's going to create low back pain. It's going to create weakness and instability, and that's something that we're going to get corrected. I'm going to show you exactly how we do that right now. So essentially, after we take this lumbar spine through range of motion and we indicate the tissue within the low back that's not moving very well, we can palpate, essentially feel where that tissue is, and I can feel that tissue right here. We're going to put some light contact. Suzanne's then going to go from this neutral position, she's going to drive in. Good. And then back to neutral. We're going to palpate. And then we're going to drive through into there. Good. You're going to go into neutral. And then we'll do 4 or 5 passes on that tissue. Good. And relax. So essentially that's how we treat low back pain, or one of the ways we treat low back pain. It's super effective. We get great results. You improve your mobility, reduce pain, improve function extremely quickly. So if you're suffering from low back pain, you have a loved one, a family member, a friend that is also suffering from low back pain, I encourage you to click the button at the bottom of this video, fill out the contact form, and then we look forward to seeing you in the office really soon. Take care.